So CNA stands for Certified Nursing Assistant, and that means that our program is actually approved through the state of Illinois. So when somebody goes through the program, then they are able to sit for the state exam and become certified as a nursing assistant throughout the state of Illinois. We take somebody who's probably never even had any healthcare experience or very maybe limited healthcare experience, and in 4 to 5 weeks we get them trained and give them everything that they need to be successful in the role. They get paid while they do the job. They get paid to learn, which is amazing. And then they're a CNA and they have this job that they get to go do with this really rewarding care. The first 10 days actually of the class is classroom time, so we're learning the theory behind it, learning about the skills, and then we practice them either on mannequins or on each other, just getting comfortable and prepared so that when we do go into the clinical for the next 2 weeks, that they are fully prepared and comfortable to perform these tasks on a patient.
So if it's their first time being a Blessing employee, they'll have to start with new employee orientation the week before the CNA program. But the CNA program, it's about 4 or 5 weeks, and you're in the classroom from 7 a.m. to about 4:30 p.m. So it is a pretty straightforward program, and but you get through it really quick. The instructor, her name is Jonna, and she's a great person. She teaches very well, and she always gives extra little tidbits about things, help you learn a little bit more. And the CNA course itself wasn't that bad, just because we had those awesome instructors there to help us through it and really make sure that we understand the different procedures and things that we do.
They make it fun. It's very interactive. You get to go over to the Sim Center a lot and do a lot of hands-on work. And I really feel like everything they taught me is stuff that I needed to know. It wasn't a lot of fluff, but it was fun all the way through. Jonna is an amazing instructor.
The CNA program puts you in a simulated bedside room, which gives us as students the opportunity to do compressions and be hands-on with the mannequins and get feedback from the instructor on what we need to be doing, where we need to be putting our hands.
Using the mannequins at the BEC Learning Center was very helpful. Going hands-on with your teammates, the people who you may be working with later on in the organization, just building that confidence with your teammates within the classroom itself is also a confidence booster. You know you have teammates, you know you have help behind you, you know you have someone who's going to help you and you're not in it by yourself.
We work in a building full of sick people, and often that means people aren't able to do for themselves what they normally would. So a CNA gets to be the person's hands and feet and eyes and ears and do those really just dignified and compassionate care for people who aren't able to do that for themselves.
So the CNAs really spend the most time with the patients. I know on critical care, I might have seen a change in the patient's condition before the nurse was able to, because I'm spending so much time with them. So you are the eyes for the nurses, and you play such an important role.
So the CNA is also the eyes, ears, hands, and feet of the nurse as well, and because they do get to spend so much more time with the patients and get that real bedside care and get to know the people so well. So it's really a hands-on and just heart-in role.
But I think one of the best things is being able to do the small things for patients. As a CNA, you're doing things like helping patients feed, get dressed, give them a bath, just talking to them, maybe brushing their hair or shaving their face, and those little things really do mean a lot.
My favorite part of being a CNA is helping the patients with their daily life activities and providing companionship to the patients, ones who need someone to listen to them.
You can tell when a nurse has been a CNA. They're more confident, they're more professional, they're just a stronger nurse. Also, when it gets to nursing school, the people who have become CNAs beforehand really have that edge because they're already comfortable with touching another human in that way. They already have a lot of the skills that they need to learn in nursing school. They're like, yeah, I already know how to do a blood pressure. And then just more comfortable when it comes to their clinicals because they already know the people on the floor, they already know where things are at. So it's a really great benefit for them, just to help them with their comfort level as they start into their nursing, nursing school, and then into their nursing career as well.
So speaking especially to my high school students, summertime is a great opportunity to do the CNA program. It is 4 weeks long, and you're getting paid to go to school, which is something that does not happen anywhere else. And Blessing hooks you up with a job before you start the program. So you're already hired on prior to taking the training. So as soon as you're done and test, you start your job right away, which is fantastic.
For doing anything in healthcare at a young age really helps you to realize if you do want to do it or you don't. Like, some people become CNAs and they say, I don't really think I want to be in healthcare, but for me, I started as a CNA and I've been working as one, and it's made me realize just how much I do love healthcare and helping others.
Becoming a nursing assistant was the best choice of my life. Being a CNA has taught me a lot about myself, and that is that I love helping people in need. It is a blessing to be a CNA at Blessing.